My research question is why there is a lack of access to healthcare in rural areas of India. The purpose of this research is to find out why there is lack of access to healthcare in rural India. This research will help to find out and then eliminate the barriers which are being faced by the rural population. They travel to cities and spend a fortune to get treatment done. Most of the rural population live below the poverty line in India. Hence, most of the times they neglect their health status due to shortage of finances. Thus, I will be able to improve the health status of people living in rural areas of India by minimizing the gap between the demand and delivery of healthcare to people of rural India. I will answer my research question by conducting interviews which will include open-ended questions. The data will be in qualitative form of recordings and transcripts of participants' interview responses. I will need 5 participants. Their age range will be 25 to 55 years old and will be both male and female. They will be doctors by professional with at least 2 years of experience of working in rural hospitals. My participants will be from India, especially from Punjab and Haryana states. My research question can only be answered by people who have a knowledge of healthcare and are part of rural healthcare system. They will be able to help me because they have been in the situation experiencing the challenges to deliver effective healthcare to people. For each participant, there will be a need to spend at least 60 minutes on the interview. I will send the questionnaire through email and schedule a time that will work for the participants for the Zoom meeting. I will record and take notes during the interview. My participants will be some of my friends who are doctors and healthcare workers in rural areas and some of other doctors who are currently involved in rural healthcare delivery. My participants could be anyone, whether I know them personally. I will be posting messages online through social media or other internet platforms to let people know that I am looking for healthcare professionals to participate in my research. I have included a copy of template of the message that I will put online with the consent form. If someone is interested in participating in my research but does not meet the criteria, I will thank them for their interest and let them know that they are not able to participate in this project. Some of the participants will be people I know personally. I will be talking to people I know over email or over the phone whether they would be willing to participate in my research. The best time to collect the data will be April 2022. Participants may appreciate getting to share about their opinion on lack of access of healthcare in rural areas of India during the interview. The healthcare workers of rural India may benefit from this research, which will focus on the lack of access to healthcare in rural areas. The community might better understand how the inaccessibility to healthcare is affecting the health of the patients and what are the barriers to deliver better healthcare in rural areas. There is an anticipated benefit to the broader society or to the scientific or secularly community as a result of this research. This study will contribute to decrease the gap between demand and delivery of healthcare in rural India. There might be various challenges to achieve the outcomes such as lack of financial incentives by government to implement the suggested solutions. I believe I am not aware of all the challenges so far. I will come across them when I will move forward in the action research. Thank you.